This is an ultrasound of a 25-year-old female, married, normal deliveries, presenting. She has been referred to me to rule out appendix because having pain in the right iliac fossa and in the right pelvic region. I am showing you the uterus in longitudinal section of the patient. This is the uterus. Uterus is unremarkable. This is the endometrial canal, and the longitudinal section is in front of you. Now when I give a sweep to the probe to have a transverse view, here comes the left ovary. Here. Now this ovary appears to be polycystic, as 1, 2, 3, 4, 5, 6, 7, 8 follicles are seen. This is the ovary. Measuring 3.1 into 1.5, and these tiny follicles, these are the developing follicles. Now I will not label it as a polycystic because I don't see any of these cystic areas or follicles exceeding the size of 5 millimeters. So anyways, this is the transverse section. So the left ovary is unremarkable and is normal with multiple developing follicles seen. And now when I move the probe towards the right side and then give a sweep to it posteriorly as it is. Now this is the transverse section. Here we were seeing the left ovary. And now when I give the sweep, I angle the probe posteriorly, and then I come across a cystic area, multiseptated. These are all septas. So many septas you can see, complete, incomplete, XY, and all type of septas are seen in this cyst, which measures approximately 4.5 into 4.2 centimeter, is in the region of the right adnexa. Does not relate to the uterus. Here is the transverse section of the uterus. This is the cyst here. And now I'm going to give a sweep to the probe to see that if it changes its shape or it retains its shape. Now this is almost a 90-degree sweep. And you see it does not change its shape, it retains its shape. And then again now towards the normal view, why it is a cyst? Because you see strong back wall is seen posterior to this cystic area. Multiseptated, well demarcated, thick wall rather. See, this is the wall, and the wall measures approximately 4.3 mm. And so far as vascularity is concerned, we do see a rim of vessel around it, but now these are the iliac vessels. As a landmark that we are seeing the ovarian cyst. Complicated ovarian cyst, these are the iliac vessels, and these are the vessels around the cystic mass in the region of the right adnexa relating to the right ovary, with vascularity of its outer surface, but with no vascularity within. Now when I move the probe now towards the dependent region, peritoneal cavity, we see clear fluid. This is the uterus, this is the endometrial canal, this is the free fluid, these are the bowels floating within it. So there is small amount of fluid seen in the dependent region peritoneal cavity. Up here in the region of the, this is the iliopsoas muscle, strip of iliopsoas muscle. These are the iliac vessels again here. And right iliac vessels, no evidence of any. And you see now, here comes the cyst under study. Now, does this cyst contain any calcifications? This will be a question. In fact, there are multiple tiny echogenic particles seen scattered through. Sorry, this is not a cyst. I am very sorry. This is the cyst. Got confused. This is the cyst, yes. Here. Now, why this is not a cyst? Now, if I show you these two areas, be careful. This is rather a differentiating point. Now, this area appears to be like a cyst, this area. This one. This appears to be a cyst with internal echogenic particles and also with small amount of fluid posterior to it. And is it a cyst? The trick is, there are two things. One, we do not see any posterior wall enhancement. You do see some fluid there. You do see some fluid on both lateral and medial sides. Now, but keep an eye on this area. When I give a sweep to the probe, it becomes a longitudinal strip. It changes its shape, and this is in fact the iliopsoas muscle. So one can easily make a mistake. However, our area of study is this cyst. Now, is there any calcification within it? Any solid element within it? We have to see that. Now, there is an echogenic rim fine, but there is no calcification seen, no solid element is seen. So this is most probably, the differential will be either an infective ovarian cyst of infective nature or mild origin of the complicated ovarian cyst because of the fluid seen. Third, hemorrhagic ovarian cyst. Fourth will be endometrioma, but she does not give a history of dysmenorrhea, is married, has normal periods, no complaints regarding the menstrual cycle. So this is a complicated cyst of the differentials I have narrated you. Next we will have to go for further investigations. Thank you very much.